If you have hepatitis C for 20, 30, 40 years, you'll develop liver cirrhosis, and an offshoot of that is developing liver cancer.
I ended up with Hep C, I think it was in my early 20s, and back then it was interferon, and interferon scared the shit out of everyone.
Ended up going to Hamner rehab and finding out that I had Hep C.
About 2017, I got tested positive.
I went for 22 years without even realising I had it.
There's an assumption that everybody who uses drugs has got a terrible addiction, and it's simply not the case. We have a wide range of clients. Some use drugs recreationally, hold down jobs, have families, run businesses. At the same time, of course, we do have clients who are harming themselves and is harming the community as a result of drug use. We don't encourage drug use. We don't say you can't use drugs. We're neutral and our service is completely unconditional. It's really, really important from our perspective to give agency to the client. This is not about us deciding what they need. It's about us giving them sufficient information to inform themselves, whether that's about the drugs they're using or the services that they want to access, but it's our job to give them agency so that they can make informed decisions.
Prohibition doesn't stop people using drugs. People always have used drugs and people probably always will. Harm reduction is really about ensuring that people who do use drugs can do so as safely as possible and in a way that reduces harm to both themselves and in the wider community. Harm reduction services are very, very effective at reducing healthcare costs, more so than it costs to provide the services.
We've got services in Invercargill, Dunedin, Timaru, Ashburton, Christchurch, Nelson, Wellington, a mobile service on the west coast and a mobile service in Northland. I would estimate that 98% of our frontline staff are people with lived or living experience of injecting drug use. And that's really the gold in our service. Our clients feel very safe coming into this environment.
I've got quite a personal affinity with this whole area of work. I used to use drugs a long time ago. I haven't actually used for nearly 13 years now. It's good to be able to use my own life experience in a really positive way to help the clients.
My name's Barb and I work at the Rodger Wright Centre on the desk. I've actually been here 28 years. I love it. It's my thing. It's my people. Those people are me,
So sometimes people come in here just upset. If I can make them smile, again as they go out that door, it makes my life a little bit better as well.
I go around the South Island doing outreach, needle exchange and Hep C tests. A needle exchange is more than a needle exchange. They go there to get needles. We can put them onto health places, we can put them onto counsellors.
Our mobile service reaches into rural communities. One of our core values is meeting people where they are, so both physically, mentally, and just wherever they could be in that stage of life. Our clients don't always engage with normal health services, so it's really important for us to bring our services to people. We cover the whole South Island from Blenheim to Bluff. We go to the West Coast, whether it's the needle exchange program, the drug checking, or Hep C testing and treatment. We find a lot better success rate because they feel more comfortable engaging with our team than they would anywhere else.
The whole point of our service here is to help people not fall through the cracks. People can just turn up, get the test and leave. People might come in for a Hep C test and then we just get chatting and then you lead on to something else about their health and it just flows from there. So it might be doing blood tests, HIV, syphilis, Hep C, making sure people are tested so that they remain well. Reducing infections, so we're preventing hospital stays, diagnosing chronic conditions early on, so that's cost saving for the health system.
Disc Trust has been involved in Hep C screening and treatment for 15 years. We've got the highest test and treat rates in the country, something we're really proud of. Hep C screening is really easy these days. We have nursing staff who can prescribe in terms of treatment. It's easy and it takes 8 weeks. So we're really working hard to promote that in the community so that people know that it's easy.
Come down to the needle exchange and get your clean equipment from us. Get a Hep C test as well. come in for a chat.
The second day after taking it, I could feel way more energy. I started running again. I looked healthier, clearer. I felt it, vibrant. Just come in. Come in and get tested.
Absolute dream to do treatment. It's like 8 weeks of pills.
I wouldn't muck around with this. I would definitely go in there, do your test, and if you need to, do the treatment. And your life will be saved, your life will be enhanced.
My hope for the future is that we can establish stable funding for the program, moving away from 1-year rolling contracts. With more secure funding, we'd be able to close some of the service gaps that currently exist. So we'd like to expand both our offering and our reach. In reaching more people, we believe we can save the taxpayer more money.
So I support DISC fully. I believe that service is absolutely saving lives, and then they need to be funded, supported, advertised, marketed as a vital part of eradicating hepatitis C.